Well, we always want to look our absolute best. Have you ever considered plastic surgery?
Well, joining us this morning is Dr. Guyuron, world-renowned plastic surgeon at University Hospitals. Doctor, thank you so much again for coming on the show.
It's great to be here.
Thanks for being here.
We're going to be talking about rhinoplasty, but before we get started, you teach other plastic surgeons internationally on nose surgeries. I find that very interesting.
Yeah, I travel about 3 months a year internationally to teach the plastic surgeons how to do this, and it is my area of passion and expertise. Yeah.
What makes a nose surgery successful?
Number one, experience. This is not one of those operations that you can do one operation every week or every month and produce consistent, reliable results. Number two, being on the same page with the patient. It doesn't matter whether I like the nose and I create the best nose. If the patient is unhappy, I have failed. Number three, we need to match the nose to the face. We have gotten away from the prototype noses. If you put 100 noses of mine or many of us side by side, not two of them are alike because there are no two faces that are alike. We match the nose to the face, and the noses look natural.
Okay. Well, now on to the other subject, rhinoplasty. And we have some pictures that you have brought with you. And I think they're before and afters, correct?
Correct.
Okay. Let's go ahead and take a look and tell us what we're seeing here.
Yeah, we are seeing a patient who has a nose that is shifted to his left, wide, and looks displeasing. And when you look at the after picture, it looks natural, goes with the face, and looks masculine. And when we look at the profile, you can see that the flaws have been eliminated rather than changing the nose radically. It still looks natural.
He still looks like the same person.
Same person, but a better nose.
And that's got to be very important to a lot of people.
It is very demanding. This is a patient who had previous surgery, and you can see that the nose doesn't look right. She also had fat injection around the eyes and laser resurfacing at the same time. And when you look at the nose now after the surgery, it looks natural. Again, matches her face. You can see how over-projected this nose is, and all of the flaws that are there have been eliminated. Again, we have returned the nose to what is incongruous and in harmony with the rest of the face.
Okay.
You mentioned fat injection. How does that work?
Fat injection actually is one of the hottest things that we do today. We suction fat from usually from the abdomen or the sides with a fine cannula, injected in the eyelids or the face or on the lips, and get a better result by restoring volume to the face. For example, on this one, we injected the lips. And you can see that they don't look unnatural. They just look, have more volume. They look luscious, but natural. That's what we want.
You're right. You don't want those like balloon lips.
Exactly. And the fat not only brings volume to the face, it brings stem cells that rejuvenates the skin, makes it more elastic, and gives a better color and consistency to the skin. Actually, it makes it a little bit lighter on the skin that is discolored. And we take those hollowness around the eyes or corners of the mouth and fine lines around the lips away, which we could not do it as successfully before we started using fat injection.
It's amazing what you can do.
That's why he's the world-renowned plastic surgeon, Dr. Guyuron, Department of Plastic Surgery, UH Case Medical Center, 440-646-2173, uhhospitals.org/plastics for more information. Doctor, thank you.
Thanks, Doctor.
Very much for coming on.
Thank you very much.
All right, we'll be right back.
This segment of Live on Lakeside is sponsored by University Hospitals.